The GOP federal spending bill, or H.R. 1, goes into effect in January 2027. Now, before then, Hampton Roads community leaders and state officials say they're working to help people complete the paperwork needed to keep their health care and SNAP benefits. Jemiah Beatty spoke with leaders about how they plan to help keep eligible Virginians covered.
Today's stakeholder breakfast focused on what happens next as H.R. 1 takes effect next year. Community advocates and state leaders came together to ensure eligible Virginians keep their SNAP and Medicaid benefits. Some of Virginia's top leaders gathered at Tidewater Community College's Joint Use Library to discuss how changes to SNAP and Medicaid could affect Virginians. Secretary of Health and Human Resources Marvin Figueroa, Congressman Bobby Scott, and nonprofit leaders led the session.
Last year we set a record again for the fourth time in 5 years and distributed 26.6 million pounds of food to our community. That's the weight of an elephant of food every hour that we're open.
Chris Tan, president and CEO of the Food Bank of Southeastern Virginia and Eastern Shore, opened the breakfast with that picture.
The lines for the food bank now are 30% higher than COVID.
And that need is not slowing down. Tan says the food bank leads Virginia in helping people sign up for SNAP benefits. He says if Virginia loses an estimated $1.8 to $2.6 billion in federal funding next year, food banks and other community organizations will feel the impact.
So what we're doing is trying to go against the intended design of the bill itself.
Figueroa says nearly 300,000 Virginians are at risk of losing coverage. He says the changes to work requirements will have the biggest impact, but the stakeholders in this room say they have a plan to keep Virginians covered.
So it is the work that we're called upon to do right now to make sure that we're doing everything possible to ensure that our fellow Virginians have what they need to be able to live their lives.
Virginia Beach, Jemiah Beatty, 13 News Now.
Leaders say they're looking at ways to automate parts of the enrollment process to reduce paperwork and make it easier for people to keep their coverage. They also plan to work with community partners, advocates, and local organizations to reach rural communities and help eligible Virginians avoid falling through the cracks.